Hello. Hi all. Today's topic is about impacted canine. Today content is definition of an impacted canine, etiology, clinical features, classification, and position of the canine tooth, and what are the investigation you do, followed by the surgical procedure and complications of an impacted tooth. So etiology, the upper canine remains unerupted less frequently than the third molar. No, uh, the most common tooth which is impacted is your third molar, followed by your canines. And the lower canine rarely fails to erupt normally, but we do see impacted mandibular canine also. So one of the etiology is thick palatal bone. The canine has to travel a longer distance from the floor of the maxillary sinus to the anterior part of the maxilla. So it takes a longer path. So there is high chances for impaction. And thick palatal mucosa tend to reflect and cause some minor impacted tooth canine, followed by delayed eruption of the deciduous canine. Delayed resorption of the deciduous canine. So this delayed resorption of the deciduous canine lead to deflection of the crown, leading to different path of eruption of the impacted canine. So what are the clinical features of an impacted canine? Obviously, you see a bulge in the alveolar ridge. You can see in the picture there can be a bulge in the buccal aspect, or it can be a bulge in the palatal aspect also. Occasionally, you cannot see a bulge. It can be in between the buccal and the palatal bone. So there can be tilting or displacement of the adjacent tooth. The impacted canine tend to tilt the adjacent lateral incisor. Occasionally, there can be a developing tumor or developing cyst, dentigerous cyst, more common in the maxillary as well as in mandibular canine. Coming to classification of the impacted canine. Uh, Class 1 is maxillary canine in palatal position. This can be horizontal, vertical, or angulated. And class 2 is labally impacted canine. It can be horizontal, vertical, and angulated. In class 3, impacted canine with crown on the palatal side and root on the buccal side, or vice versa. Class 4, vertically impacted canine between the lateral incisor and the first premolar. In class 5 is impacted canine in the edentulous maxilla. In class 6 is unusual positions. Classification of mandibular canine, again labial and unusual position. So labial, it can be vertical, oblique, and horizontal. Unusual position, it can be in inferior border or in the ventral protuberance, or it can be migrated to the opposite side. What are the investigation? We need to first take an IOPA. So IOPA will tend to identify the tooth and followed by OPG. OPG can show where is the positioning of the canine. Recently, cone beam CT gives accurate positioning of the impacted canine, which is easy for planning for your surgical procedure. In difficult cases, where there is no bulge seen, or for canine or for orthodontic purpose, better to go for a CBCT. So once the canine is identified and you want to go for a surgical procedure, either for exposure or for a removal, we have two approaches. One is labial approach with clavicular incision and vestibular incision. Then you have palatal approach. Labial approach. This is a highly placed canine where the orthodontic purpose we are going to remove the canine and suture it. It cannot be treated with orthodontic appliance. So we're planning for removal. So there's a vestibular approach where the incision is made in the maxillary vestibule and deepening the incision is deepened to the periosteum to reach the bone, and the mucoperiosteal flap is raised. And you can see the impacted canine which is exposed with the burr. So once the canine is removed, the socket is curate, and you see a remnant of the dental follicle, and it is curate. This is the extracted canine teeth, followed by closure. The next approach is the palatal approach. Palatal approach, we are not making a vertical releasing incision, it's always a envelope flap. You can make a clavicular incision from premolar to first premolar. The bone is guttered, and then tooth is elevated from the socket, and wound is closed and dissociated. So there are unusual position of the maxillary canine. There are also, you can see unusual position in the floor of the maxillary sinus, or you can also see close to the nasal cavity, or you can also see um, near the orbit also. Coming to the complications, there are only few complications like bleeding. Bleeding may be from the soft tissue, or can be from the marrow bleeding, or it can be from any vessel bleeding also, minor wounds from the vessels, and altered wound healing, or maybe impaired wound healing or delayed wound healing, then paresthesia or altered sensation. It can be maybe due to excessive stretching of the nerves, like infraorbital nerve, or suppose in case of palatal approach, the patient can have a paresthesia in the uh, anterior part of the maxilla, stretching of the nasolabial nerve, nasolabial uh, uh, nerve. So we'll just see the surgical video of the impacted canine. So this is a case of labially impacted canine, which is approached through the vestibular approach. Yeah, this is a 3D CT where we can identify the exact position of the canine in all three planes. After assessing the scan, then we plan for label approach. So since it is high, we plan for a clavicular incision extending from the central incisor to the premolar of one side, and a distal relieving incision is made. After incision is made, a mucoperiosteal flap is elevated to expose the uh, canine. In this video, you can see mucoperiosteal flap is elevated, followed by exposure of the canine. You can see the bulge, labial bulge, and followed by removal of the bone. Using a rotary instrument, we remove the bone, uncover the crown of the impacted canine. So once the crown is exposed, then we section the tooth. So crown and root is sectioned. Then the remaining root part is elevated from the socket. This is the remaining root which is elevated with the elevator, either Copeland's elevator or a Cryas elevator. Followed by, then we have to remove the follicle, because the unerupted tooth which is which is surrounded by a dental follicle, has to be removed to prevent any further pathological changes there. So once the tooth is removed, wound tolerating is done, and bony edges are smoothened and flap is sutured and secured with a black silk. Thank you.